A new study has found that the coronavirus pandemic is continuing to affect ethnic minorities disproportionately. Despite the inequalities exposed earlier on this year, researchers say there has been little effort to stop COVID-19 from hitting minority ethnic communities the hardest. Let's speak to Dr. Parth Patel, a research fellow at the Institute for Public Policy Research, who also worked as an A&E doctor during the first wave of the pandemic. Dr. Patel, good morning to you. Thank you so much for talking to us.
Good morning, Kimberly.
Just talk us through the research.
So our research, this report by the Institute for Public Policy Research and the Runnymede Trust in Carnal Farah, looked at the scale of this inequality, these disparities between ethnic groups in terms of how they experience COVID. And essentially what we did, we looked back at the first wave and we put into context how big is this inequality. And we find that over 58,000 more people would have died in England and Wales in the first wave of COVID if the white population experienced the same risk of death as the black population. So that's the issue we're talking about here. It's big. Then we looked at what's under the bonnet, what could be driving this. Some people have said it's to do with underlying diseases, things like diabetes. Our research finds that's not the case, and underlying diseases explain only a fraction of this massive risk disparity. What we find is likely to be driving these inequalities are structural differences in terms of the conditions in which people live and work. And the government's new report agrees. They too say that what's going on here, what's driving these inequalities are to do with structural differences in terms of the jobs people do, the conditions in which they live. And then what we do is we go on to create a set of policies or measures that we recommend the government enacts to stop these inequalities playing out to this extent in the second wave and what is going to be a tough winter ahead.
So it's not that, say, you're a black man that makes you at a higher risk for catching COVID-19 or from dying from COVID-19. It's that you're, say, a black man in the UK.
So that's correct. There's nothing inherent or innate within different ethnic groups that makes them more susceptible to COVID-19. It's about the societal conditions in which people live. And like we said, it's about the jobs people do, it's about their housing conditions, it's about their level of deprivation, their ability to self-isolate. That's what's driving this. The important thing to note is that even when we account for all of these factors, we take into account all of them, there is still a sizable chunk of this increased risk left unexplained. And that's really important. So ethnicity, even then, is an independent risk factor for predicting poor outcome from COVID.
Okay, so what can be done about it?
So we know two things overall. First of all, we know that minority ethnic communities are more likely to catch COVID as an infection. And then once they do catch COVID as an infection, we know they're more likely to come to harm or die from COVID. So those are two big buckets we can think about. We can try and reduce the infection rate. We can help and support people to self-isolate. One of the calls we make is about temporary accommodation. We know how important household transmission is in spreading COVID. We know that many minority ethnic people live in conditions that make isolation just too difficult. We also know that it's a tough winter ahead for the hospitality sector, and there are lots of empty hotels around the country. So we asked the government to make use of this temporary accommodation and provide it to people who need to self-isolate but can't because of the conditions in which they work. Now, the precedent's already been set. In the first wave, the government offered a similar scheme for NHS workers. I myself was offered this. And so we're saying, let's expand that. That was a great policy. Let's make sure that in the second wave, people are supported to self-isolate. Less than 20% of people in the country isolate properly at the moment. Now, that's a crazy figure. It's already difficult for everyone. Now, some conditions in which you live or work in make it absolutely impossible. In terms of that second one, so we know that even after getting infection, many minority ethnic people suffer more harm from COVID. What could be going on from there? Once you get the infection, why do you get more unwell? The first thing could be underlying diseases. But our research, as the ONS agrees and other research groups have agreed, finds that actually underlying disease is only a fraction of what's going on here. So perhaps healthcare access is important. And what we find suggests that might be the case. Black patients are over 50% more likely to need resuscitation when they get to accident and emergency. That's a big fact. They could be turning up to hospitals too late. And we asked the government, why don't we think about that? Why don't we encourage people to seek healthcare in a timely way? And why don't we remove barriers, policy barriers, that put people off seeking healthcare?
Okay, Dr. Patel, we're going to have to leave it there, but that's really fascinating. Thank you so much for talking to us.
Thanks, Kimberly.